Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome to the show. Like many of you, I have caregiving responsibilities for my mother. So hopefully today's episode is going to give you some information that's going to help along your journey. We're going to start our mental health series. And today we have a special guest, Landy Blackmore, who is Director of Business Development for Hickory Trail Hospital. Welcome.
Thank you. Thank you.
Well, it's so great to have you on the show. You've got some great information we want to get to, but I'm just kind of curious, what attracted you to this line of work?
So to be honest, I wasn't super attracted to this line of work at first. It was scary to me, but so I got my degree in recreational therapy.
Okay.
And I moved to Texas 4 years ago and was searching for internships, and one of my only options was to go and do my internship at a psych hospital. Okay. And as terrifying as it was, I was very excited for the challenge and to learn something new, and I ended up falling in love with it. I did my internship there.
Okay.
I then, right after I graduated and got my license, I went to a memory care and was an activity director and learned a lot about dementia and older adults, and just really fell in love with that scene too.
Yes.
And kind of merged my love for mental health and older adults. So I worked there for a while and then ended up coming back to psych and have kind of gone back and forth between psych and working with our older adults. So.
Wow.
Yes.
Wow. That's great. That's great. So as a activities director for seniors and dementia memory care, wow. So you actually coordinated activities for them that they would understand and could participate in?
And we used a lot, recreational therapy, a lot of people don't know a ton about it, but it's using art and music and play to have healthy coping skills and to find ways when we do get aggressive or agitated and things like that. And so giving our seniors some of those tools to help.
That's amazing. Well, I'm sure a lot of people don't know about that, using art and music.
Yes.
Wow.
And play and all sorts of things.
And play. Did they participate?
It depended on the person, but for the most part. And it was really interesting. I was just telling someone last week, there were certain individuals that they may have been late stages dementia, and they may have not been able to communicate with their families or remembered who their family was. But if you put on that Elvis Presley song, they sang every single word. And
they remembered that.
Yes, it was
back
so
good
cool
memories.
to be a part of that. And to be a part of just bringing engagement into those last moments. So.
Well, I love hearing that because I've heard from different families. I know one particular story that sticks out. One of my families had their mom was an opera singer, and she was trained in opera and in college. And so they allowed her to sing at the facility. She remembered all that, She could remember what was going on currently, but she remembered the songs, her training, her voice was still beautiful. That's great. You give them opportunity to do that. Yes, that's just awesome. So give us a little history about Hickory Trails. How long has it been around, and do they have certain specialties? But give us a little history.
Yes. So Hickory Trail broke ground in the 80s.
Okay.
So it's been around for quite some time.
It has
Our
been.
parent company is very large.
Okay.
So we have grown and expanded a lot since that time, but we were one of the first in the Dallas area. And since then, we've changed kind of what it looks like a little bit differently and the populations that we serve. But right now we serve ages 5 to 100.
Wow.
So pediatrics all the way to geriatrics.
Okay.
And it is acute. So typically with most situations, there's something that's going on that the individuals are harmed to themselves or others, and they just need some more help to stabilize.
Okay. So your typical person that's admitted to the hospital, how does that usually happen? Do they come from home or another facility? What is usually the scenario? Is there a variety of things?
It's definitely a variety, and it depends on the age.
Okay.
A lot we see with kiddos and stuff, a lot of foster schools. But with our Jerrys, we do see a lot from nursing homes, from long-term care facilities, assisted livings, memory cares. And then also from the hospital and sometimes from the police as well.
Okay.
Most of our Jerrys, I think a lot of it is dementia-related behaviors that they need some med management to address some of what's going on, but not necessarily. Sometimes there's depression and other things that come with dementia diagnosis, with aging, not being able to do things how you always were able to do, right?
Right. That could be frustrating. Yes.
Yes,
Yeah.
but we are acute, so our goal is to manage meds and send back home.
Okay.
Or send back to wherever the next environment that they need to be is.
Okay.
Yes.
Well, how does, for our audience, and I know I'm not always clear on this either, dementia and mental health, how are those two related?
They're related in a lot of ways.
Yes.
And I think a lot of times with dementia, behaviors sometimes happen in the later stages, sometimes even in the earlier stages when there's frustration about knowing that you're confused but not understanding why you can drive to the grocery store but you can't figure out how to get home.
Right.
And so sometimes there are some behaviors and some things that people kind of need to work through.
Yes.
And it's difficult to understand because a lot of the time the families think, well, my dad would never do that.
Right.
He would never respond in that way. But it is the disease a lot of the times and not the person. And we start to see mental health kind of tying in sometimes with some pretty severe depression and some pretty severe psychosis sometimes and hallucinations and delusions with certain kinds of dementia.
So there is a lap over between
Absolutely.
from dementia. And, I get this question a lot, not that I can answer it, but I'm sure you're more capable of answering this. Dementia and Alzheimer's. What are the differences? I mean, are they in the same mental health arena as well? Or is dementia a part of Alzheimer's, or how are you guys treating that?
So I always explain it as an umbrella.
As an umbrella,
so,
okay.
And I do a lot of like in-services for nursing homes and
great.
the CNAs and their nurses just to kind of say, hey, we're not going to respond to this behavior the same way your gut probably tells you to respond. So we need to address things differently. So I'm going to a lot of them, and this is something that I'm explaining, is dementia is like an umbrella, and Alzheimer's is like a subcategory. So when we say dementia, it's a broader term for Alzheimer's, for Parkinson's, for Lewy body, all of those different kind of
Different
subtypes.
ones.
Yeah.
Got it. Well, that helps a lot to even begin to understand the situation. And I know I've heard from different people, caregivers, and different people in the senior community, their opinion on, responding. Do you play along with it and not try to, if they say, well, if they're having a memory, going back in time on a memory, and they're thinking they're seeing someone else. Some people say play along with it, don't get them upset. And others are trying to convince them, no, you're not there. You're not there. This is 2021. It's not 1952. But it's like it's combative.
Yep.
And you don't want them to get upset.
And it just escalates the situation.
Yes, yes.
Yes. Yeah, so I had my certified dementia practitioner as well. So this is something that we learned a lot about.
Yes.
And something that I tried to help the staff understand at some of the senior living environments that I worked at. Whatever their perception is, that is the reality.
Yes,
and it's
true.
Difficult, and even with psych, with adults and with children, we don't address it that way always.
Okay.
Most of the time, you want them to know reality. You want to do some grounding and help them understand what is reality. But with our older adults that are struggling with dementia, there may not be any sort of changing their minds.
Right.
And so sometimes to avoid, and obviously, you want it to be a safe situation.
Right.
And you don't want to let them play into whatever's going on if it's a situation that's putting themselves in danger.
Yes.
But if it's something small, just Pick your battles.
Yeah, you're right. Pick your battles.
Yep.
Because it's, even with someone who doesn't have a mental health issue, it's easier to deal with people when they're calm anyway. So you don't want that to escalate because of your approach.
Yep.
Yeah.
And not only that, but people think more reasonably when they're calm.
Oh, that's true. That is so true. That is so true. I tell my clients all the time, I say, we're talking about the estate planning and things like that. Make these decisions while you're calm and you're not pressurized, because you don't have to, make a quick decision. You can take your time, and nothing's pressuring you to make to do these estate planning documents. You can just do them at your leisure and do it while you're calm. Because when a situation arises, it is hard to think logically.
Yep.
Yeah, and reason. You're under the gun at that point.
Yep, that is true.
Well, tell us about the programs, the senior programs at Hickory Trail.
Yeah, so the nice thing about our hospital, and something that makes us a little bit differently, is that we haven't stayed the same way since 1988. We've tried to adjust and really figuring out what is going to serve our patients best and how do we get them the best care. And something that we've recently been talking about is actually getting a lot of our mental health technicians who do primarily work the geriatric unit, helping them with their CNA. And so that's something that's not very commonly seen in the mental health hospitals. That someone has kind of that dual, being a mental health technician and being a CNA.
A CNA too.
We've actually started hiring some CNAs.
Yes.
As well as started kind of offering incentive to some of our all-star.
Oh, that's great.
Yeah, our mental health technicians to really make sure that we're doing it right, and because ADLs are definitely a part that we're seeing that we have to help take care of when they're coming in. Additionally, we have a wonderful, wonderful recreational therapy team, and that's special and close to my heart, but they have sensory bins, and we really are trying to redecorate and make it so that it's an environment that feels like it's for older adults, right?
Oh, very good.
Yes. So my recreational therapy mind kind of helps because I have the vision of, sensory things and things like that. But we definitely have a great team who's there and is really making some great changes.
Well, you are very well qualified and suited for this position because you can pull from several different areas of your training. And now the sensory bins, what is that like? Paint a picture of what a sensory bin is.
Yeah, so, and I used to do it a lot in the memory care setting as well. So maybe it's having different kinds of pastas all mixed in one bowl. Like, you have your hard not cooked pastas and have different colors. Maybe you have some bow tie and whatever else. Yeah. And you have that senior sort them.
Oh.
And it's purposeful, right? Yeah. But it's also sensory because you can feel it. Sometimes it looks like vision sorting colorful towels or laundry. And a lot of the senior living communities are adapting that kind of programming as well. Purposeful things so that they feel like they're helping. Right?
Yes, that's true. That's true.
So we're even integrating that into our setting where there are sensory things. If someone is getting a little agitated, maybe they need to do some art or things like that we're integrating as well.
Oh, that's great, because it's like anything, if you don't use it,
you
lose it, right?
So
we all have to keep our brain in motion and thinking and the cognitive part of it. Now, you mentioned ADLs. For our audience, what is an ADL?
Activities of daily living. So
activities of daily living,
You're brushing your teeth, washing your face, combing your hair, going to the restroom sometimes with some incontinence, showering.
Yes.
And something that I talk to a lot with the nursing homes is the more you know about your resident, the better. So the more you know about your loved one, the better. Showers may be incredibly difficult, and we may have some behaviors during showers because it's scary, but maybe warming the towels or also getting them distracted and talking to them about their job, what they used to do. It really, really helps.
Great idea. Great idea. Well, because I think about that when I go to the doctor and have to take a shot or something, and they're just talking. They're just talking. I'm like, why are you talking to me? I'm focusing on this needle over here. And but you're right, it does distract you and get you thinking about something different. So let's talk about, you have services specifically to seniors. So when they come in, what happens if a senior doesn't want to be there or they don't want to be admitted to a psychiatric hospital? What do you do at that point? Can the financial power of attorney or the medical power of attorney admit them?
That is a great question. So, power of attorney in most situations with mental health is not honored in the state of Texas.
Okay.
So, there have been very, very few and far between situations. Most people don't know to do this, but sometimes if there's a specific clause in the power of attorney that says mental health treatment and outlines acute inpatient psychiatric care.
Okay.
Sometimes we can, but most people don't think about that. No one
Right.
plans to have to bring their loved one to a psych hospital to get some stabilization. So guardianship is honored in the state of
Okay.
Texas. I have not seen many of guardianship, but there are situations that you can get an emergency guardianship through the state. And you probably know more about that than I do with your background. But additionally, there are processes that we can do court orders.
Yes.
It takes
Yes.
a little bit of time, and it is a little bit challenging for our older adults. But we are navigating it, and there are ways to work with the courts.
Yeah. Well, this is going to be so educational because most people don't take that leap from dementia to mental health or a psychiatric hospital. They're thinking dementia, medications, and memory care. They're not thinking that it's a mental health situation that might just, need some psychiatric acute help at certain points.
And it's actually not uncommon for a lot of our older adults with dementia to be on some sort of psychotropic medication.
Okay.
It's not
Okay.
uncommon. It actually happens quite often. So.
Yes. Yes. Wow. What about, have you dealt with families? I know it's hard for a family to even to come to grips with that, with dementia or memory loss or confusion anyway in their loved one. How do you, I guess you have to kind of monitor or deal with the entire family when you're dealing with this, and it can be very emotional.
Yes.
Wow.
And we have a case management team that they are planning discharge from the time the patient comes to the hospital.
Okay.
So our average length of stay for our older adults is about 10 days.
Oh, okay.
It's quick. And
That is quick.
It's even less for adults.
Okay.
But they are automatically on the phone with the families, with maybe whatever facility they came from.
Yes.
Maybe it's finding a different facility that's a bit of a better fit.
Right.
Or some other resources for the family. So we have case managers that are automatically on it, and they are
Very
assigned
good.
to that older adult.
Yes.
And they're working with their family to make sure that we are making sure they have a safe discharge plan.
Okay. Okay. So are there, does the family have their own doctors that see them and make rounds at the hospital like other hospitals, or are there staff doctors there, psychiatrists and psychologists available all the time, or how's that work?
Yeah, that's a good question.
Yes.
So we've always got nurses
Okay.
on our unit, and then we always have mental health technicians.
Okay.
And the mental health technicians are more assisting with like ADLs and getting to and from places.
Yes.
And kind of de-escalating some time if there's some frustration. And then the nurses are handling a lot of the meds. And additionally, we do have an internal medicine team as well that rounds every single day on our geriatric patients.
Okay.
So they're available to our adult patients when they need it,
Right.
but every single day for our geries.
Oh, that's
they're doing
great.
rounds. And then we do have a geriatric psychiatrist as
Psychiatrists as well. Very good.
Yes.
Very good. Now, have you? I've heard this a lot from different people and families where their loved one, they're fine during the day, but as the sun starts to set, it starts triggering, maybe depression or confusion, and then they snap out of it. And is that something that would be an acute situation, or is that something they can probably just handle with their regular doctor?
Yeah, it's very dependent on the situation. So you're talking about sundowners.
Sundowners. Yeah, that's it.
A
Yes.
lot of people call it. And
Yes.
we do see a lot of kind of someone needing to come in because they are escalating so much in the evening.
Yes.
That they maybe are a harm to themselves or others. And
Okay.
so sometimes they do need to come in and get med management, and that's why they do stay with us for 10 days.
Okay.
So that we can see how the meds are affecting them, see if it's helping, because we want them to come home better.
Right.
Whereas sometimes you just go to the doctors, right, and they give you a med and say, okay, let me know how it is.
Right.
Doesn't always work.
That's true. That's true.
So that's part of the reason for the inpatient setting, so that we can monitor those medication adjustments and make sure that it is the best situation.
Okay. Okay. Now, can the family members see the patient while they're there? Can they come in and visit them, or is it better to kind of keep them away, or how does that work?
Also,
does it
very
depend?
dependent on the person. With COVID, a lot of facilities aren't being able to do visitation right
true.
now.
Yes, yes.
But for us, it's not so bad because they're there, 10 days.
Right.
So it's not that bad. Sometimes it is better for the patient to just kind of have some space.
Some space.
Sometimes families are the stressors.
Yes.
Sometimes. Or
We all have situations. We all know
Yes.
situations in families that can be stressful just
yes.
to deal
or
with.
sometimes the older adult is the stressor.
That's true. That's true.
Sometimes the family needs a little bit of a break.
Yeah.
Where, it is very emotional for a lot of the families when dad
Yes.
doesn't remember that you're his daughter.
Right,
Or things
right.
like that. So sometimes space is good.
Yes,
We
yes.
encourage it in a lot of situations, but sometimes the family does help the person feel a little bit more comfortable too. So,
Yes, yes. And just familiar things. I know when my mom went to skilled nursing. One facility had some little shadow boxes where you could put things in that was familiar to them.
Yep.
And it does make them feel, like they're remembering something, and something is theirs, and feel a little bit more comfortable.
Yeah.
Yeah, yeah. So what about what's unique about Hickory Trail or in your company in general? And because you said you have several different locations.
Several. We have 6 in the Metroplex.
Okay.
And 400 nationwide.
Wow.
It's massive.
Wow. Are they mostly boutique hospitals, or
A lot of
just
them are
depending on the
acute
size?
inpatient, but
Okay.
we have some that are more on the medical side
Okay.
as well.
Okay. Okay.
But a lot of them are psychiatric.
Yes.
But we do have like residential treatment facilities as well, some
Oh.
outpatients.
Okay.
So there's a big scope of a
Yes,
lot.
yes.
We're a part of Universal Health Services, so
Okay.
UHS. So
Okay.
quite a few people are familiar with that.
Yes.
But I think what really makes us different is we do not all look alike. So
Right.
we try to find our niche and
Yes.
try to find what does our particular area need? What does
Okay.
our community need?
Yeah.
And our hospital is probably not having the same types of programming that our hospital in Wyoming is having.
Well, that's true. That's true.
It looks a lot different.
Yes.
And so we really try to hone in to listening to our community.
Okay.
And finding out, we've got certain communities here that have certain adolescent programming or, a veterans program. So kind of dependent on the area.
The area,
But we
okay.
do definitely tailor to whatever our community needs, and we're changing with the times.
Yes.
Yes.
Well, it sounds like it. Yeah,
Yes.
it sounds like you guys are. You're way ahead.
Yes.
So, wow. So what about we were talking about the family interaction, and one of the chapters in my book, Creative Caregiving and Beyond, talks about the family. They're meeting at Thanksgiving and they're noticing that mom and dad are forgetful and they're forgetting a few things where they put things and things like that. What would be your advice on when a family's beginning to notice that type of thing?
Plan ahead.
Plan ahead.
I think in so many situations, and I can say right now the
Yes.
setting that I'm in is very crisis.
Yes.
You're dealing with crisis a lot of the time, but it doesn't hurt to just know the resources that are out there.
Yes.
When I worked in the senior living space, we saw a lot of crisis and
Yeah.
families that were coming to us and saying, oh, we just can't leave mom alone now. And it's very stressful and difficult on the families because you have to sometimes you want to be able to shop around and
Right.
see what the next step is, whether that be a long-term care facility, maybe a home health coming in, things like that.
Right.
But you want to have those things in place ahead of time if possible.
Yes.
And a lot of people, I feel, are in denial.
Yeah,
And
yeah.
they think, well, we've got a long, long time.
Right.
What they don't realize is that sometimes the fall can really exacerbate the symptoms and really just down funnel that
Yes.
dementia.
Yes. I've heard that too. Even a UTI, urinary
yes.
tract infection,
Yep.
I've heard can trigger dementia or
Yep.
something. Maybe it was already there, and it really triggered and accelerated it to a great degree. And so, but basically, would you say typically it is a gradual process? So there are signs that the family usually sees, but maybe they don't want to deal with it at that point. And sometimes,
But not always.
but not always.
And it's hard because dementia's not cookie cutter. It doesn't
Okay.
always look the same.
Okay.
I saw residents that came in and, had one fall and they may not have lived a few more months. But I saw residents that were at very late stages
Okay.
that their mind was a little bit further along, but their body was healthy.
Right.
And they were
Yes.
just walking laps,
Yeah.
every day.
Right.
And so it's very different, and it's challenging, and I think that's what a lot of people get stuck in is, well, not my mom. She's not going to be one of these people who we have to put into
Yeah.
a facility within the first year of being diagnosed with dementia. But
Right.
sometimes it is.
Yeah.
And there's no way to know. There
Yeah,
really
sometimes
is
you
no
just
way to
don't know. You're absolutely right. You just don't know sometimes.
Yep.
Well, what would be some closing thoughts you would like to leave with our audience? Any tips or thoughts about, or myths you'd like to debunk about a psychiatric hospital?
Yeah.
Because when you hear that, you think of Psycho or something, some of those
Right,
movies
yeah.
you've seen,
Yes.
but it's they're there to help people. Yeah, they're there to help people with a mental health issue. Yeah.
I think something that a lot of people, and especially our older adults, our
Yes.
older generation, people didn't talk about mental health.
Well, you're
And
right.
They didn't talk about what was going on and
Right.
if they were struggling with depression or
That is so true.
they didn't talk about it.
Right.
It was kind of a taboo. And
Right.
that's something that I've really been trying to help in our community is just normalizing the conversation around mental health.
Yes.
Doesn't mean you're weak. And even for our adult children who may have to deal with bringing their loved one to a hospital, it does not mean that they are crazy.
Right.
At all. Not
Right.
at all.
Right.
It means that they need some help.
They just need
and
some
that's
help.
okay.
Yeah.
That's
Yeah.
okay. And I think a lot of times people are scared to make that step because they think maybe quality of living might be affected, but I've seen so many times it's necessary for quality of life to be so much better
Right.
to get that help before it is way too late.
That is so true.
Before
That is
it's
so
way too
true.
late.
So they can have a quality of life. Yeah. That is so
And
true.
I mean, our position in the community, we definitely want to serve to just help educate people and
Yes.
help people understand that it is okay not to be okay, and
Right.
it's okay to get help,
Yes.
regardless of what age you are. And so we're definitely here as a resource.
Well, I think it's great that you guys are doing that you are emphasizing the education, even with the staff and the CNAs,
Yes.
because they're the ones right there on the front lines dealing with the patients. They see them more probably than anyone, and it's great that they can understand.
Yes.
Yeah.
Yes.
That is so. So if someone wanted to contact Hickory Trails, how would they go about doing that?
So we have our website.
Okay.
Hickorytrails.com. And
Great.
then additionally, you can also just Google,
Okay.
and there's a phone number to our intake.
Okay.
So it'll bring you directly to intake. And even if you just need some information or something's going on that you just have a question, need some resources,
Yes.
we're there for that as well. So,
Wonderful. Wonderful.
yes. And then also we're on, Facebook and LinkedIn and all that good stuff too. If there are individuals that are intrigued and have a heart for older adults and maybe want to try working with our older adults in the mental health setting,
Oh,
we do
wonderful.
have positions available and are hiring therapists and nurses
Great.
and techs. So yes, we would love for more people who do kind of have that passion for our older adults to
Yes.
come in and work.
Well, and it does. This is an area where you do have to have a passion. You have to be called, so to speak.
Yes.
It's not something you just do for the paycheck. You
Right.
do it because you have a calling and you want to serve and you want to help people. So and thank you, Landy. I can tell you have that
you.
type of heart.
Thank you so much.
Yes, thank you so much for coming on the show. And you've heard, we're going to put up the links for to get in contact with Landy and the Hickory Trail Hospital. It's been so insightful, and we are just excited that we're educating the public about mental health and dementia being a part of that. It's so important for us to understand because we may have family members that we're dealing with right now that are going through that, and we want to make sure we can get them the help they need so they don't have to suffer through it and you don't have to suffer through it. So thank you for watching the podcast. We also encourage you to go on to social media and as our podcast airs, and like us and like our channel and subscribe to our channel. And don't forget to go just love on a senior, and it just might brighten your day. Thanks for watching.